Hey y'all, I want to have a real conversation today, not as a pharmacist in a white coat, not as someone who is quoting textbook verbatim or data verbatim, but more so as a mom who has been pregnant, a mom who has, before getting pregnant, had struggles, multiple miscarriages, who asked a million questions and who had those same moments where you stare at information, you think about the things that you're putting in your body and wonder if this is going to be okay for my baby or my future baby. And even as someone with years of training and teaching in pharmacology and clinical pharmacy world, I'll, I'll be really honest, like pregnancy shifts all of that. Like it does not matter. And as an example, I had a colleague who is also a pharmacist who stopped taking one of her main necessary medications the moment she found out she was pregnant. Now, she did so with caution, but she knew in her medical brain that there wasn't really a reason to stop that medication. But her mom brain, the one that is shaped by her prior miscarriage and her desperate desire to protect that tiny human that she was growing, really overcame that. And logic just did not matter anymore. And that is so true for really all of us, a lot of us, I know. We become so cautious, extra cautious, and that's not a bad thing. It is really good, super good to pause, to question, and to think twice about what we are putting into our bodies. So I want to be clear. I want to be very clear. Anything that you put into your body during pregnancy, from a prescription medication to an over the counter product to herbal teas, deserve caution, cheerful caution, and consideration. And that doesn't mean that you should be scared. It just means that you should be very intentional about what you're doing. The hard truth is that every single chemical, whether it is natural or synthetic, it can be a medication or something with processed foods, can interact in your body. And during pregnancy, your body is doing one of the most complex, most delicate pieces of artwork that it will ever do, which is growing another human being. So when it comes to something like acetaminophen, it's not really thinking about is this good or bad. It's more so I want you to understand how it works, how it behaves in your body, and what we currently know about it. And so with that in mind, if you are new, my name is Takova. I am a pharmacist. I am a mom of two littles. I have a 3-year old and a 1 year old. I have suffered multiple miscarriages in the past before getting pregnant with my two children, and also had 3 failed IVF transfers um, before getting pregnant naturally with my two children. And so here on my channel, though, I focus on making sure that medications make sense to take you from overwhelm to empowerment, from confusion to confidence with what you are taking and why you're taking it. So in this video, I want to just speak as a human and as a mom about this acetaminophen thing that's out here in the universe, and not here to really tell you what to do, but hopefully to provide some clarity and some calmness that might lead to a little more confidence in whatever decision you decide to make. So I am going to put my pharmacist hat on for just a second, and definitely keep it in plain language. But when you take any medication, but in this case, talking about acetaminophen, I'm not going to use any brand names. Acetaminophen, which many organizations have their own product of acetaminophen, but that medication is going to be absorbed into your bloodstream, and eventually it will travel to different parts of the body to do its job. And in this case, it's primarily reducing fever and relieving pain. And it reduces fever by acting on some temperature regulating centers in the brain. And it reduces pain by decreasing the production of something called prostaglandins, which are chemicals in our body that trigger pain and trigger inflammation. Those are really the primary two. Now, the pregnancy specific part of this is that our bodies act a little bit differently in pregnancy. And many medications, many substances, including acetaminophen, can cross the placenta. And the placenta just being that super incredible, amazing organ that is the bridge between your body and your baby's body. It provides your baby oxygen, nutrients, and it also acts as a partial filter. And I'm very intentional with that word partial because it blocks a lot of harmful substances from getting to the baby. but it's not a brick wall. So small substances, things that are fat-loving molecules or substances, things like acetaminophen, can pass through the placenta fairly easily. And so once they cross the placenta, that drug is now going to circulate, or that substance, whatever it is, that chemical is now going to circulate in the baby's system. And sometimes the amount that gets past the placenta is similar, concentration, if you will, that you have in your body. Not always, but sometimes. And that can sometimes be an issue because your little baby's liver and your little baby's kidneys are immature. They don't break down medications and they don't clear them out of the body the way that our mature adult bodies do. So that's why we're super cautious. It's not really because acetaminophen as a chemical in itself is inherently dangerous. It's because we respect how delicate the fetal environment is and the fact that certain medications can cross the placenta into the fetal environment. So the good news about acetaminophen, though, is that its mechanism of action, the way that it works, does not directly affect fetal development. And we know of several medications that if we give it early in development, or even some of them later stages of development, but most of them are early on in the first trimester, they do interfere with DNA, or hormone production or organ formation in some kind of way, form, or fashion. But acetaminophen, due to its mechanism of action, the way that it works, it doesn't have those same risk. And the other thing about acetaminophen that we know just as a fact is that its half-life, which is how long it stays active in the body, is relatively short. It's about 2 to 3 hours in most people, which is why when you dose it, if you're taking it continuously, you'll take it around every 4 hours or so, just because it's pretty much going to be broken down and being cleared from your body starting around that 3 hour mark. So excuse me. So that means that it does not accumulate significantly, is what I'm trying to say. The other thing is that the data really does hopefully bring us some peace. This is a medication that we have been using for decades, literal decades of data that's showing that acetaminophen during pregnancy is safe. It's one of the most commonly used medications by pregnant people across the world. Many other countries use paracetamol. We use acetaminophen. They're the same thing. And we have a lot of very large observational studies, a lot of meta-analyses that have consistently shown us that when used at recommended doses, emphasis on recommended doses, when used at recommended doses, acetaminophen itself is not associated with birth defects or miscarriages or developmental issues. And so that is just based off what we know, what we see, not one or two cases, but millions of cases. Now, there are some studies that suggest that there are possible links to things like ADHD or asthma. So yes, those things are out there, and that information is important to note. But the key, I think, in thinking about some of those is that many of those studies are correlational, not causational. And so, in other words, they show a loose association, but they can't prove that acetaminophen was the cause. And many of those studies have also noted confounding factors or external factors like maternal illness or genetics that could also explain the outcomes that they found within their correlation. Our medical organizations, like the American College of Obstetricians and Gynecologists, which is called ACOG, continues to consider acetaminophen as the first line option for pain and fever during pregnancy. And again, when used at recommended doses and used appropriately. And with any medication, we want to use the lowest dose possible for the least amount of time possible. And that is going to vary depending on the person. So just keep that in mind. But the bottom line that I want to, get across in this very quick video is that yes, acetaminophen does cross the placenta. And yes, your baby is exposed when you take it. But also, yes, it has been safely used by millions of pregnant people for decades. And the key here is moderation. Use it only when you absolutely truly need it. Avoid any unnecessary medications, period. And, you know, I am the type of person that big pharma, I know there are people out there that think that pharmacists, physicians, other clinicians have some type of stake in the game when it comes to pharmaceutical companies. We do not. We have no direct payment system or communication with them. And in fact, people like me, pharma probably won't like, because I'm constantly telling people, if you don't need medications, don't take them. But in the cases that you do need them, we want you to be cautious and take them appropriately. And there are a lot of instances where people do need medications. So I say that to say, just only use it when you truly need it. Be very selective about that. Avoid any other unnecessary medications, and always, always, always loop your healthcare provider or practitioner in before you start anything new, even if it is something harmless like an over the counter, or seamlessly harmless like an over the counter product, or even if you're just trying to take acetaminophen. And I'll say this too, it is 100% okay to feel nervous. It is okay and encouraged to ask questions. And if you are not overthinking, then I would be a little concerned. Like, the fact that you are watching this, the fact that you are overthinking and concerned, you're already showing that you are being a good parent. And that means that you are doing the best that you can to make informed decisions for you and for your baby. So, to all my mamas, to all my mamas to be, my encouragement to you is to be cautious, but don't live in fear. Ask questions, seek evidence, and remember that the goal isn't to eliminate every single risk. Lord knows I wish we could. But I mean, my child, every time she jumps on the trampoline or goes to gymnastics, I'm a little terrified inside. But our goal is to make thoughtful, informed decisions, protect our children the best that we can, because we know that it's impossible to reduce every single risk. And in doing that, in taking care of our children, we need to make sure that we are prioritizing both our own health as well as our baby's health. And so I'm here, I'm cheering you on, not just as a pharmacist, but also as someone who has walked that same road, stared at the same medications, substances, prayed the same prayers, and just, really come out of that on the other end, knowing that I have done my due diligence in making sure that my babies, whether I was currently growing them, breastfeeding them, or now, rearing them, as the elders would say, I have done my due diligence. So I'll leave it at that. If this video has helped you feel a little more confident, a little less overwhelmed, hit that like button, subscribe to my channel, and share this with another expecting mom. And I'll see you in the next one.